Welcome to Once a Nurse, the original. This is Leanne Meier. I am the host, and I am very, very happy to be here each time I have the opportunity to speak with nurses and to nurses. So when COVID started in 2020, I became very, very quickly realizing that I was probably going to be in quarantine for most of the time of COVID, and that did end up being the case. So my main goal that I had was I wanted to be able to help nurses. I thought somehow that the organizations were going to step up and really, really help support nurses and be there for them and keep them informed and keep them fed and watered and all of those good things. But somehow or another, in a lot of organizations, that never happened. And so I kept looking for people who could connect with nurses, help them work through any of the issues that they had been experiencing for years prior to that, but especially during that portion of COVID. And so today I am so grateful to be able to talk with Audrey Boyce, who is an RN, and this is what she does. She talks with nurses. She's a leadership and wellness coaching services that's the name of her company. And she's an integrative medicine certified health and wellness coach. She's also had 30 years of experience. I just am when Audrey and I talked earlier, we just hardly could get off the phone. We're so enjoying the conversation. So I want to bring Audrey in. Thank you for coming and joining us, Audrey. I so appreciate you being here.
Yes, thank you so much, Leanne. It's my pleasure to be here and to be discussing this very important topic of creating a healthy and a good culture for nurses at the hospitals or wherever they are.
Wherever they are, right? It's like if you can learn to create it at the hospital, you can learn to create it everywhere. And I had to laugh because that was one of the things that I used to teach back when I was in doing classes and doing trainings was how to create and accommodate, or how did we call it? How to create environment that's welcoming. And so there's lots of ways to do that. What I'd first like to do, though, Joyce, is Joyce, my mouth is all turned around here today. So Audrey, could you please share with us how you came into nursing and how you came to be where you are now?
Thank you so much. If I were to say how I got into nursing, I would have to go back from the age of 8 years old. When I helped a blind man cross a very busy intersection.
Interesting.
And I felt so happy that I had made a difference that it was at that time I decided I wanted to be a nurse. And so I went to nursing school and I became a nurse. And from that time, I knew exactly what my calling was. I was very clear about it. Even when I was admitted into nursing school, I did have some challenges with actually getting started. Mm-hmm. And those challenges went on for a few years. As a matter of fact, it went on for 5 years until I was actually able to enter into nursing school. Well, when I got the opportunity, I was sure that was what I was called to do. Mm-hmm. But, life is as such that the 5 years, I spent that time teaching at the elementary school.
Okay.
And that was part of my preparation because I don't believe anything in this life that you do can go for naught because it's all aligned with what your ultimate purpose was. So those 5 years, as I waited to get into the nursing program, I went to college and became a teacher and taught for 5 years.
So and when you graduated and went into nursing, what area did you go into? Pediatrics, or what area attracted you?
Well, when I started nursing, I went into med-surg. I remember exactly this big hospital that I would pass by while I was going to my clinicals and so forth. I said, I would like to work at that hospital. And for some reason, we did not do a clinical rotation at that hospital. But when I graduated from nursing school, I applied there and I got accepted. And I remembered when I walked through those tall doors. And I went to the floor and I was greeted by the nurses there. And I remember entering my first patient's room and saying for the very first time, I am your nurse. So that was a special, special moment for me.
I wonder how many people in other careers, just in general, have these kinds of like almost beatific, I can't think of another word that works better there, but I talk to so many nurses, and so many nurses have this sense of awe that comes with this job, either from when they realized that, yes, this was the career they wanted to have. So we're talking about, a culture, healthy cultures for nurses. Um, how how are you? I know you're working with nurses. Can you share a little bit about what are some of the things you hear from nurses that you work on with them?
Yes. And I must say, for the past 2 years, I've been working with nurses, doing one on one coaching and group coaching and masterminds. And this started, of course, after the pandemic. It was something I always wanted to do because I had an experience where I went through a period of burnout as a nurse.
Mm.
And I did not know what to do. I had no solutions. I had to find my way back. It took me a little while. It took me a year being away from nursing to get back to myself. I took that time off to make self care a priority. I took that time off to focus on what I really wanted to do because when I left after being so burnt out, it wasn't because I didn't love nursing, it was because I had lost my purpose. I had lost vision of my purpose. And I had to reconnect with that. And once I did that reconnection, and I also worked with a coach, I must say, it wasn't just by myself. I made self care a priority. I worked with a coach, and I had a new sense of what I wanted to do. And those, I would say, were the three things that really helped and guide me back to the path of going back into nursing. So when I went back into nursing, and this is now about over 10 years ago, 10 to 12 years ago, I noticed that the nurses that I had left when I had left a year ago, they were experiencing the very same problem I had experienced some year before. And I started to talk to them about caring for themselves and that they must take time off. And back then we were always signing up for those extra shifts. I mean, it wasn't COVID, but yet there was such a shortage in nursing. And so we were signing up for those extra shifts continually. And I think it was, a combination of that I had experienced my burnout and some other things. But my nursing colleagues were doing the very same thing when I went back and I told them, you cannot continue to do this. And so that was the spark that really laid the foundation for me to start working with nurses. Fast forward, COVID comes. And at this time, I am not working in the hospital anymore. I'm working in senior living community. But I'm connected with my colleagues and I started to hear the nightmares. Now, it was on TV. Everyone was seeing what was going on. And so, with that in mind, I started to document stories from my colleagues and from other people that I know. And I started to just create a space for them to come to me and to share what was going on.
Mhm.
Yes.
And did you have to? So many times, nurses don't really have any idea of how to become an entrepreneur. So did you do that on your own, or was that through the coach that you were working with, or how did you find your way through the jungle that's out there now? I mean, so many people are going toward entrepreneurship, and it's not easy.
It's not easy indeed. And I must say, I kind of go back to the words I heard Warren Buffett says that anytime someone asks to work with him, he asks them the question, have you ever failed before? Because he says he would not work with anyone who has not had a failure in their life.
Okay.
And I like to reframe that as failing forward because I've had
Mhm.
that. I've had two businesses in the past, not nursing businesses. I'm talking about a real estate business with my then spouse and also a car care business. So I was very familiar with the whole idea of entrepreneurship. So it was not something new for me. But those two businesses, they did not survive during the downturn in 2008 when the market collapsed. And so I was familiar with failure. So I understood that part of the business and how you have to proof your business. You have to somehow weatherproof your business to withstand certain things like that. So this time around, I was very much intention and saying, I'm going into entrepreneurship. I need to have everything in place that I would need in case there is something that goes wrong. I mean, we talk about your strengths, your weakness, the opportunities, the threats. That SWOT analysis we might have done in school at
Sure.
some point in
Yeah.
our
So,
learning.
do you coach nurses on becoming entrepreneurs, or do you have a different focus with them?
No, I do not coach nurses to become an entrepreneurship. I coach nurses how to reconnect with their purpose,
Okay.
how to reconnect with that purpose of when they became a nurse. And sometimes that purpose keeps them in nurses, and sometimes that purpose evolves and they go into entrepreneurship. And
Hmm.
that is okay too. And
Hmm.
like you say, once a nurse, always a nurse. So even for me, I still care for patients in another business that I have, but the one that I focus on is focusing on nurses who are experiencing overwhelm, fatigue, and wants to reconnect with their purpose. How to go from burnout to breakthrough to abundance. That's the nurses that I work with and
Say
provide
that again. How to go from,
burnout to breakthrough and to abundance.
okay, I like that. Um, you really have to have that moment of accepting, looking at, dealing with what the reality is for you. And so many times it's not even about what you have or have not done. Like you said in 2008, that was really about what had happened in the economy of the world, and particularly in the United States, that impacted everyone around the world. It was, away from our control. So it's back to that kind of thinking of what do I control? What do I not control? And how do I want to move forward? Tell me about, like, if I were coming to you and I said I've just had enough. I don't know if I want to stay in nursing. I don't know what I should do. I feel like I've had it.
Yeah.
What would you? How would you start with me?
And that is the real stories of what I've heard during the pandemic. I've had enough. I've done my best. I clocked in the morning and my manager hailed me as a hero. But when I couldn't work that extra shift, I became the villain. Those are not my words. Those are
Yes.
just the words of one of my client.
Yes.
And so I want to share her story with you. When she came to me, I got the call and I could hear in her voice that trembling. I could hear in her voice that desperation. And she said, I do not know what to do.
Mhm.
And she shared that she was working 4 and 5 12-hour shift.
Oh,
She
oh,
could
oh.
not do it anymore. And she was a traveling nurse, but she started to travel before pandemic. And so she was out in California. And when she called me, she said, I cannot do it anymore. And I said, I listen. That's the first thing I do. I listen and I validate because nursing is a very rewarding profession, but it also could be very overwhelming and it has a high stress on a day-to-day basis because of the patients we care for, because of the long hours, because of the many uncertainties we work with. So I understood that and I let her know that I was listening to her intently. And so I allowed her to speak. And after I asked her, so what do you want for your life? And that was the question
Just
I asked.
gave me goosebumps.
What do you want for your life? And
Yeah.
she paused And she said, I really like being a nurse, but I have to take care of myself. I said, yes, that's exactly what you've been neglecting to do. So through that process, she was able to identify what she was missing. I really didn't take her show her anything new that she didn't know. But all I did, I held a mirror in front of her and allow her to in a new way and to pause and to take that breath that she needed to.
Yeah.
And through working with her for 6 weeks, she came to the realization, though I love nursing, I want to step away from it for a moment.
Mhm.
And she did have to step away from nursing for a moment. For some clients that come to me, they may change their specialty. They may go from maybe working from an ICU to working to maybe at an outpatient or at a place that is much more lower pace.
Mhm.
But the first thing I do, I really try to get nurses that come to me to really reconnect back with that purpose. As for me, I did reconnect back with when I was that 8-year-old kid that helped that blind man cross that street.
Yeah.
When I got through my burnout, that is what kept me from saying, yes, this is what I was called to do. So that would be the first thing I would do,
You
having
know,
them reconnect with them purpose.
this career is really even more than a career. I don't know if I've ever talked to a nurse that didn't speak about it from that sense of passion and that sense of mission. And yet what has happened, it seems like, is that the organizations who hire nurses are not recognizing that. And so they're looking at it from a completely different point of view than what it is that attracts and draws nurses and all healthcare, people who are in healthcare. They're coming because they want to help, and yet their organizations are many times setting up a barrier rather than trying to open the way so that they can do the work that they love and do it so well.
Mhm.
It's hard to understand how they could not know that that is depleting of anybody. I mean, if you're working in a factory and you're putting the same widget into the same, you know, um, device a million times a day every day, you get to the point where you just cannot keep doing that as a human being. And nurses are way more than putting widgets into devices.
Exactly.
So, what are some ways that you have found to, well, maybe you've just kind of talked about it a little bit, how you are able to help people go from overwhelm to relief. How I think a lot of times nurses don't realize what their options are. We come out of nursing school and we think, oh, well, of course, I'm going to go into the hospital and I'm going to learn all these incredible things that I, just got a touch of in nursing school. um, but they don't realize what else is possible. And that is something that I experienced myself. I thought I couldn't leave the bedside because I wasn't going to be good at anything else.
Yeah.
And what I keep trying to get across is that nurses are so precious that if they can be a nurse for any period of time, they can do anything. What are your thoughts about that, and how do you approach that idea of ongoing happiness for nurses?
Yes, and that is such an important point you made that when you started out as a nurse, you might have think that okay, life is always going to be beautiful. And one of the things that I do share with my clients and my nursing colleagues is to really set clear and realistic goals or expectations. You know, yes, when you start that first day on the job, you're filled with that happiness. I remember mine, like I said, I walked into my patient's room and all the hard work and sacrifice I had made through nursing school and did not go to this party when I could have gone, but I wanted to study. All of that disappeared when I said, I am your nurse. So I had achieved what I wanted to do. But then, I quickly realized even with the joy and the passion you have for the career, you're physically and emotionally at risk for burnout, for overwhelm, and fatigue because just of the very nature of nursing.
Mhm.
And so, one of the things that I do talk about is setting realistic expectations. You are there to support and to care for your patients, but sometimes you are not going to save all of them because some of them you're going to lose them. So when you have that patient that did not do as well as you expect, you don't blame yourself, but you take a moment to debrief and understand what happened. Set expectations also that you are not going to cure everyone, you're not going to be able to help everyone. So being clear about that, I think, is very important for nurses. Also, I want to say another thing is that nurses must learn to take breaks in between caring for their patients. That is something that we overlook. And I do in my book that I wrote, I call it a mistake. Not something wrong, but a gap, a mistake, a mishap. If we fail to take breaks, we are not caring for ourselves. And we know the first thing we should have to care for ourselves in order to provide excellent care for our patients.
Mhm.
So that would be another
It's
thing.
interesting that you say that. My first job was on nights, 11 to 7. I was working alone on a large unit. Um, and I just, the supervisor would come up to relieve me.
Mhm.
And I would say, oh my gosh, there's no way I could possibly take a break. I wouldn't even be able to relax. And she said, you will take a break because I am going to insist that you take a break. And so I would very reluctantly. And she would do some of the things that I was worried about getting to happen. And so when I did come back, I did have a different perspective for it. But when she was not the supervisor, oftentimes I might not see the supervisor who came around, or if they did come around, they certainly never offered to do any of my work to help me be able to get a break. So I had that little bit of balance to realize that it seems illogical when you're so busy to take some time to rest, but it's important. And the same thing is true between shifts and having time free, for ourselves. So there's a lot of expectations being put on us as nurses that we need to push back on. And that's finally what's happening as nurses are standing up and saying, enough. We're not going to just keep making it work for the organization.
Yes, exactly. We must be advocates for ourselves. We must speak up for ourselves and also for those around us. But the next things I would say also, we have to make priorities. We have to set our priorities. There's not everything that we're going to be able to do in our shift.
Mhm.
We have to set priorities. And that is something where I believe teamwork really comes into place and the culture of the workplace. When I work 12 hours and I'm expected to do work that should be done in a 24-hour span. So, priorities, clear expectations, and coming back to the point of the break, because I think that's the one that is so overlooked because taking a break could be just 5 minutes, taking a sip of tea. For me, it would be tea. Some other people, it may be coffee. I'm not a coffee lover, but tea, I can do that any moment and feel refreshed. Or just taking a moment to do some deep breathing. Being a mindfulness practitioner, I love the times when I could take a break just to deep breathe and to reflect on what happened for the past couple of hours. So that would be something I would advise.
So, what kind of feedback do you hear from the nurses that you're working with when they go back to their shift or go back to their department? What do you hear from them afterward?
Yes, that's a great question. Just on Tuesday night this past week, we did have a room with some nurses, and we actually it was on Clubhouse, and Clubhouse is a audio platform, and we meet once a week or sometime every other week, depending on scheduling. And we have time where we speak with nurses and they come on, and it's a safe space for them to share. And so there was one nurse that was in the room and she was on break. And what she said is that I feel as though I've had no boundaries. I feel as though I've not set any boundaries. I'm saying yes to everything and anything because we were talking about self care. And
Mhm.
self-care is not just the massage, the,
Go to
you
the
go, you take
spa
care,
or
the spa. It's not
take a
just that.
vacation, all those things.
Right. Those could all be part of it, but the boundary part where you're saying no when you are overcommitted or spread thin already, and someone else asks you to do something that doesn't align with your purpose and does not support your well-being, to gently say no,
Mhm.
that's setting boundaries. And
I'm
so
going
that
to
is
bet
one
that the
thing.
nurses give you some pushback on that, especially now in this environment when there aren't enough nurses to start out with. And so, if I, as a nurse, am coming in and saying, really, I'm already overwhelmed, I can't take another thing, so you're going to have to take an extra amount than what you feel comfortable taking. So, how do we really work in this environment when we are not being supplied with the support and the staff that we need to be able to do the work that's being asked of us, not to mention what we want to do to help our patients.
Right. I know that that's a real concern right now. And, in the whole idea of teamwork, sometimes we have to go over and beyond of what we may want to do and help someone else, because we know that caring for patients is every nurse job. And so in that moment in time, it's something that we do what's necessary. But as it goes on, it should not be a pattern where we are being asked to work and care for patients in a 12-hour period, doing things that should take 24 hours to do. So I say, yes, in moments of need, it's like I understand the moments of crisis with the COVID. Yes, nurses had to work long hours, and that's where a lot of the fallout is, because now that COVID is over, I don't think that they've been addressing the problem that happened during COVID. It's after what is being said, it's doing as though, oh, you experienced that, move on with your life.
Yeah. Oh,
The
great.
world
Oh,
is move
yeah,
on.
on to the next.
Exactly. The
So,
world is move on. The world is open up. Nurses need to just snap out of it and move on. And it's not that easy.
yeah,
We would not ask
but
anyone.
that's not healthy to do.
Exactly. We would not ask anyone who went and fight a war to come back and to just say, move on with your life. We see the turmoil that happened with people that went and served in war. We know about
Sure.
post-traumatic stress disorder. It is very real for nurses.
It is. It very much is. And I feel almost like if you were working during COVID, you probably have PTSD on some level. And I think it's really important that nurses give themselves permission to see somebody like you, or go to a psychologist, or see their minister, or whoever it is that they feel that they can truly open up to. And I really recommend that nurses talk to other nurses, because so often what happens is when you talk to somebody who is not a nurse, they really do not understand what it is you're experiencing. They may assume that you are experiencing maybe something they have experienced, and they don't realize that what you're experiencing has to do with life and death. And if you are too tired, or not um, uh, open, like your brain isn't open enough, or you just can't function, and something happens, you've forgotten something or whatever, somebody could die, something really, really bad could happen. And so it's a whole different environment than what most people are thinking of. So what do you think nurses need to be asking of hospitals, and what should hospitals be offering to keep their nurses?
Yes, those are two loaded questions. But you hit the nail on the head saying that nurses, we should not do it alone. We cannot do this journey alone. We need each other. They need to find out who can support them, reach out to others that could support them. And yes, they may have friends and family, but it's very important sometimes, based on what they're experiencing, to reach out for someone who can support them in for mental support, mental health support. In terms of the hospital, I believe the hospital can do more, and I say it unapologetically. because I saw how the hospital did rise and they were able to pay out millions of dollars per month to support the care by paying traveling nurses.
Mhm.
And, whether it caused a fallout or not, that's not the point. The point is that they saw the need and they realized that they had to find a solution. Right now, nurses are walking around, they're surviving, but they're not in a state where they're thriving. I recently attended a alumni event for this nursing school just about 2 weeks ago. And every nurse that spoke about what they experienced during the pandemic did it with tears in their eyes. There was no dry eyes. I was there listening, and I myself was affected by that. And so I believe the hospitals need to provide support for nurses. We know they have this EAP, the Employee Assistance Program. And from what I've heard from most of the nurses, they do not feel comfortable with those services. I know it's meant well, but they do not feel comfortable with those services, with really sharing things that might affect them.
Affect
They're
their jobs.
concerned that it can get back and may not serve them well in the end. So I believe setting up some third party of nurse coaches and therapists would be something that would be very much accommodating and welcome by nurses to support them. So I believe that's one thing that the hospitals can do. They also need to foster a real open and supportive environment, allowing nurses to share their truth, having spaces in the hospital where nurses can go. The same way they've set up in hospitals for many years, we know, like a chapel, and you can go into a chapel and spend some quiet time. They should have certain rooms that nurses can go in and share and have support people. I also am a faith community nurse. That's a specialty I practiced for
Mhm.
3 years. And when I practiced that specialty, it wasn't just for patients, it was also for nurses. And what a faith community nurse does, she intentionally cares for the spirit. And that
Mhm.
is something we don't hear a lot about these days.
Exactly, especially in organizations where it is like I used to work for some Catholic hospitals, and faith was an integral part of what it was. And I'm sure other denominations, Lutherans and, all of the different hospitals that they have created a hospital for people to come that share that faith. Um, there's sort of a feeling of, oh, don't talk about politics and religion. And when it comes to life and death, you better be talking about religion, because or even spirituality. And it's very, very different for each person. So not putting your own packet of what is right, but really being able to listen to what does it mean for them.
Exactly. And I think in a open, we just came out from the nurses week, and that is another thing, offering appreciation for nurses, not just once a year when it's nurses week, but throughout the year. Nurses wants to feel valued, they want to be respected, and oftentimes they do not get that feeling that they're respected.
Yeah, they aren't being respected, they are being abused. And even if the employers do not intend that, that is what is coming across. And because so many nurses are feeling that way, it is the reality.
Exactly. And also, we've heard about the recent uptick in violence against healthcare workers, nurses, and other healthcare workers. And that also is a real concern for nurses. I mean, they've had to withstand COVID and everything else, and now it's having to be concerned about their own safety and security. And
Sure.
so hospitals have to do more to help nurses in
So
so many.
maybe I know that you have a book. Would you like to speak just a little bit about that?
Well,
So,
yes, thank you so much. Well, based on the many stories I heard from nurses, not just nurses that were working in hospital, but nurses in hospice, nurses in senior living communities, hearing their stories of what went on during COVID, I've compiled this book, and I've put it and listening to what they did and what they did not do, I've put it and I frame it as the 10 mistakes overwhelmed nurses make. And this basically is a book that looks at how nurses can be recharged, rejuvenated, and how they can own their own destiny
Mhm.
through by making not making the mistakes or the consequence that follows with the mistake, but choosing to do what's right by them. And the big thing I talk about is how to manage stress and reframe it, how to self-care, how to provide self-care. And these are some of the things that I talk, how to reach out for help when it's needed, how to set boundaries, how to advocate for yourself, and how to take time off. And after going through a lot, sometimes self care alone is not enough. What does radical self care looks like? Where you prioritize your self care in spite of everything else that's going off. And that may mean sometimes stepping away and
Mhm.
just doing exactly that radical self care.
And I think that's one of the hardest things for nurses to do is to say, I have to, I'm at a point where I cannot help anybody else until I help myself first. So that's something that we need to do. Maybe your next book has to be on a handbook for healthcare or hospital organizations to know how to treat nurses, respect nurses, include them, incorporate them in what they are so good at doing. Who knows? But I know that you're going to be coming to the Power Up Nursing conference that's on June 22nd through the 24th, and you're going to be one of our speakers. And I'm so happy to know that that is going to happen. And you will, I'm assuming you'll also be able to talk to some of the nurses, maybe share your book with them. What are your feelings about going to this conference? Why do you want to be there? Why do you want to talk to the nurses?
Wow. Yes. Thank you so much for asking me that. Coming off of the pandemic, nurses have been so isolated. They've been reaching for something and not receiving it. I believe this conference is going to be a place where nurses could come and meet with like minded people like themselves, and where they can learn new ways, get new ideas, new innovative ways of doing things that they might not have thought about before. I'm excited to help nurses to really reclaim their passion for nursing and find that balance that they need. And my goal is always to help them to stay in the profession. And so, therefore, I'm excited with what I'm going to share that is going to make a difference. And then, not just a difference in the future, but right there at the conference, they'll be able to start making that difference, making that commitment to themselves, to care for themselves, and to be the advocate for themselves like they need to be. So, I'm excited about it.
How is there anything you would like to say to the nurses who are thinking about this? We've had a lot of people who are looking into this, kind of an amazing number of people looking into this. What will be that thing that will really make them say, I'm picking up the phone today and I'm going to register? I need to be one of those 350 nurses that are going to be at this conference.
Yes, if you would like to take your life to the next level, Power Up is the conference where you need to be at. Because I looked at the roster of speakers and what they're going to be bringing. I am excited to be there, not just as a
Yeah,
speaker, but as someone that is willing to, and I'm ready to learn new things about the nursing profession. I'm willing to learn new things about my life. I know there's going to be something that will transform you personally and professionally. So, this is the place to be.
great. Well, maybe you will share with us a 1 or 2 minute video that will just, impel or encourage people to come. We're going to be putting out lots of things like that. We'll be playing these podcasts as we go forward. And these conversations have been really fascinating for me, too. So I look forward to meeting you in person in June. That will be a wonderful experience. And I am just I don't know what to say. So I'm going to close the show here. And thank you for being with me today. And let's look forward to some pretty incredible conversations and lots of breakthroughs.
Absolutely. My pleasure. Thank you for having me on.